child is brought to an ophthalmologist with white yellow pupillary reflex area. Other symptoms like cataract, bulging eye, and convergent squint. What is the investigation of choice? Now, as we know, in retinoblastoma, this is the clinical features like leukocoria. Okay, what is leukocoria? It is just this the white or yellowish light pupillary reflex on examination. It is also given in the image. Now, what is the investigation of choice? As we all know, the investigation of choice is definitely the MRI, not CT, X-ray, or USG. When they asked about the specifically for India, yeah, there are still we use the CT scan, but majoritarily it's also this trend is also converting into MRI now. The MRI is best modality for this retinoblastoma. If they ask what is the initial investigation, then we have to change our answer. It's not MRI, then we should to go for the USG. The initial investigation is USG. The investigation of choice is this MRI. And if they ask what is the gold standard investigation, it is the biopsy or the histopathological examinations. All right. So now let's understand this retinoblastoma in some depth. Let's quickly discuss the retinoblastoma disease, the most common primary intraocular malignancy in children. It is sporadic. The age presentation is less than 3 years. The gene gets mutated is the RB gene located on this chromosome. Most common associated malignancy with RB is the pinealoblastoma. Most common secondary malignancy is the osteosarcoma. The signs are leukocoria, as we seen in the clinical question. We have the white yellow pupillary reflex, strabismus, convergent squint, or esotropia. Then secondary glaucoma. Investigation, we have MRI. Initially, we can go for USG. If they ask specifically for the India, it's CT scan. But nowadays, the modality is changing towards the MRI. So gold standard is biopsy, and the histopathological feature, it is a flexner intestinal rosette, which is specific for retinoblastoma. See, it's very easy to understand the histopathological feature because you just have to see the picture. You just have to see the slide. If they ask the slide or the given the image, you have to see the circular central lumen. If you easily, it's very easy to identify that circular central lumen. All right. So once you identified it, it's very easy. Whereas in the homoright rosette, you can't able to see the circular central lumen. Alright, it is haphazardly arranged, and it's very easy to identify or differentiate both these rosettes. And let's move on to treatment. We have to remove the entire eyeball enucleation. Chemotherapy is carboplatin, etoposide, and vincristine, CEV. So you just have to know this classification. Don't have to go for much depth, but you should remember the name of this classification, which used to predict the survival of the eye after the local therapy. Okay, the Risi Ellsworth classification. Thank you.